With COVID-19 cases spiking, infectious disease expert Dr. Zain Chagla back on Morning Live. Good to see you via Skype. Happy Friday.
Happy Friday. Good morning, Bob.
Good to see you. So on Wednesday, the Prime Minister said we are in the second wave. Are we?
Yeah, I think so. I mean, we're seeing growth of cases day by day, and it's starting to become multiple chains of transmission in our community. I think we're right at the cusp of going up, and I think it's time for our public health officials and politicians to declare it so that we all understand that this isn't just a small rise. This is real and heading to something that could be very bad if we don't step in.
Yeah, absolutely. Now we're seeing the spike in case counts. The ICU numbers are remaining steady. Is that because it's younger people responsible for the spike?
Yeah, exactly. I mean, we see this pattern around the world. It's been a young group that gets the big growth, and then it starts slowly transferring over to the older, more vulnerable group, and it takes time. I think France, Germany are dealing with this right now, where they're seeing 27, 28% increases in the number of people per week ending up in hospital after seeing what we're seeing right now a few weeks ago. So it is a lagging marker, but it is also a call for action, because if we don't do anything now, it's going to get to that point in a few weeks.
Yeah. One development since you and I last chatted was British Columbia has dropped the list of symptoms, like the criteria for kids to remain home. There's a number of symptoms that they have dropped from the list, and Ontario's looking at adopting the same. Is that a good idea? Is there a concern like maybe some of these symptoms should remain? Could any cases slip through?
Yeah, I mean, I think it's playing the balance. So for all of these symptoms, there are a number of kids that have COVID that have these symptoms. There's a number of kids that have other diagnoses that have these symptoms. And there are these symptoms alone versus developing other symptoms. And so all of these are trade-offs in terms of how much you want to cast the net versus how much noise do you want and how many false positive kids do you want that are screened for symptoms. So, I think BC is trying to be a bit more liberal and say, listen, these are the things we consistently see in children as part of the screening criteria for COVID-19. Some of these other things we don't see very consistently unless they progress to more symptoms. And they're just causing a lot of stress on the system in that sense. So, I think we have to look at the data and what's been reported to date and where our kids are showing up with symptoms. There's not going to be one unified approach here that's going to approach kind of perfect for every scenario. And we may miss some with kind of narrowing the definition down. But it has to be balanced against all those other children that have probably non-COVID illnesses that are being excluded from school.
Right. I downloaded that COVID contact tracing app ages ago. No notifications. Is this thing effective? Has it been a game changer? Has it helped?
I mean, there's been case notifications. There's been a few cases that have certainly been identified from this. There's a lot of people that have been prompted to go to testing that, couldn't even think about where they were exposed. So it certainly is working. It needs a bit more modification, I think, for things like healthcare workers who are constantly seeing COVID patients and they're going to get pings every 10 minutes. But for the general sense of it, I think it has picked up a few cases that would not have been identified outside of the app working.
Right. But a bit of a limitation though with the Bluetooth, because you have to be connected for 15 minutes. Mm-hmm. So that would. How often does that happen?
Yeah, I mean, it's a surrogate marker. It's not perfect, right?
Right.
You're just trying to simulate what you think is a risk scenario in real life with the Bluetooth. But world experts have looked at the software and said, from a privacy standpoint, it's high grade, and I think it's our duty. I think as things are going up, and we don't know what the COVID patient beside us actually looks like, it's important that everyone downloads the app for sure.
Yeah. Hey, just a few seconds left, but also in the news, Johnson & Johnson heading into third phase trials with a single shot vaccine.
Yeah,
that
really
would be a
exciting.
big difference with deployment.
Yeah, so amazing for deployment. It's not frozen, which means some of those cold chain issues we talked about, that the actual rolling it out to communities is going to be a whole lot easier. There's a lot of hope in this vaccine for the sake of it. From a mass vaccination campaign standpoint, it might be the easiest one to roll out. So let's hope that's the one that actually hits the target.
Yeah, all right, and hopefully more positive developments when we speak next. We really appreciate our weekly chats. Infectious disease specialist, Dr. Zain Chagla. Happy Friday. Have a great weekend.
Take care. Bye-bye.